Good morning. 7 News Time is 6:50, and joining us we have Dr. Fahd Rawra joining us to talk about actually bereavement and grieving and how we deal with that.
Sure. So I want to talk about grieving the loss of a loved one. I wanted to start out with talking about what the normal grieving process is, and then point out some of the red flags that require immediate medical attention. So grieving the loss of a loved one, something almost everybody is going to experience at some point or the other during their lifetime. Symptoms range from of a normal grieving process range from problems with your sleep, loss of interest, feeling guilty. And I just want to expand on the guilt business a little bit.
Okay.
Guilt is basically blaming yourself, feeling responsible, or having this sense of responsibility. Hey, it's my fault. And as long as you are feeling responsible, feeling like it's your fault pertaining to the death of the loved one, that's still considered to be within the normal grieving process. If, however...
Because a lot of people feel that way.
Yes. So that again, is part of the normal grieving process. If, however, you start feeling guilty about other things pertaining to your life, so, for example, if somebody's great-grandmother passes away, and they're feeling like, hey, maybe I could have done more, maybe I could have talked to the doctors more, gotten her to the hospital quicker, that's okay. But if now, you know, if they're having any problems with their marriage or having financial issues, and they start focusing on those things and feeling kind of this sense of responsibility, overwhelming responsibility, so they start focusing on that as far as the guilt.
So it could start like bleeding into other areas where you feel the guilt and you start becoming depressed.
Yes, so feeling guilty about other things, that's a red flag, and that's not part of the normal grieving process, and that's something that requires medical attention, or immediate attention. Other symptoms of a normal grieving process are problems with your energy, problems with concentration, appetite, feeling hopeless, helpless, worthless, crying a lot. Now, a lot of times when a loved one passes away, there's this sense of this yearning to be with or reunite yourself with that loved one, or hey, why couldn't I have been the one who passed away? And that too is acceptable, part of the normal grieving process. If, however, you start experiencing or feeling like you want to act on those thoughts, that's a red flag. Okay, so that's very, very important.
So if you hear somebody saying, I think I'm going to join them or whatever, something like that, you might want to maybe
have a conversation with them about that.
Can a family member who is seeing that this is happening to someone, can they talk them into getting help, or is that hard to do?
Oh, no, absolutely. And like I guess what we talked about in the past as well, the family and social support is very important to look into these things, or to basically keep an eye out on these things if any of these red flags are there. There's one more symptom I want to talk about. Feeling like you're hearing the person, or even at times seeing the person that's passed away. That, believe it or not, can be part of the normal grieving process. With a caveat here. If you feel like you're hearing voices that are telling you to hurt yourself or hurt anybody else, that's not normal. That's a red flag. So it's okay if grandmother who's 85 years old and she feels like grandfather who's passed away she can hear his voice, that's fine.
And sending positive messages or something.
Yeah, but if there's more to that, that's something that's a red flag. That requires immediate medical attention.
Okay.
Now, one last thing. As far as the normal grieving process, if it goes on for more than 2 months, any of these symptoms, the normal symptoms, then that's also of concern. That kind of goes beyond the realm of a normal grieving process.
Thank you very much.
Very
we
useful.
have to wrap it up, but it's so interesting and, of course, very important to look out for all of that.
Thank you.
Yeah.
Be right back.